Hello, this is Dr. Moreno and I am going to be discussing a medical case with you guys. Here at Grace Women's Medical Center, we offer support to those women who are pregnant or wish to become pregnant. We also offer other women's services. Our clinic consists of 4 obstetrician gynecologists, including myself, who are passionate about what we do. As reproductive specialists, we encounter many cases which may sometimes be difficult, but we always find a solution. In this case, I'm going to be talking about cervical cancer. Cervical cancer is mostly caused by human papillomavirus, also very known as HPV. 16 out of 18 women with HPV will most likely develop cervical cancer. Squamous cell carcinoma is the most common type of cervical cancer, with 9 out of 10 patients having it. Women with early cervical cancer usually show no signs and symptoms. The symptoms begin to show until the cancer is very invasive. Some of the main symptoms are unusual vaginal bleeding or spotting after the menstrual cycle or menopause, bleeding after vaginal intercourse, or bleeding after a pelvic exam. Other symptoms are metorrhagia, which is unusual discharge with some blood between periods or after menopause, and dyspareunia, which is pain during vaginal sexual intercourse. Treatment for cervical cancer depends on the stage of the disease. The most common types of treatment are surgery, radiation therapy, chemotherapy, or targeted therapy. There are some lifestyle changes that can be made to prevent cervical cancer from recurring, which are to quit smoking, maintain a diet high in vegetables and fruits, and getting the HPV vaccine. Also, having a pap smear done annually will lower those risks. Treating cervical cancer is a process that takes time, and therefore there is no specific time in which the patient may be cancer-free. Patient A, in this example, has early-stage cervical cancer. She is 48 years old, a female of Caucasian ethnicity. She is a middle-class lady who annually gets checked. She has no concerning previous medical issues except for a chlamydia infection 3 years ago, and this is the first time she gets diagnosed with HPV and cervical cancer. She is to be treated with laser surgery, and if further she will need chemotherapy. The patient will have to schedule a follow-up appointment so that we can begin the process for surgery. I will then be examining her twice a year to make sure that the cancer does not reoccur, or if the second cancer develops, we catch it on time. To help prevent patient A from getting cervical cancer again, she will need to get an HPV vaccine and a pap smear done at least every 6 months. Also, because patient A is a daily smoker, she will need to reduce and best recommended to completely stop smoking. Patient A will also have to maintain a diet high in fruits and vegetables. The patient is highly aware that once having cervical cancer, there is a very high risk of a second cancer developing. Other doctors should be careful when reviewing patients' medical records. For example, women who have had past or current chlamydia infections have a higher risk for cervical cancer. In this case, we found the patient had a previous chlamydia infection, which we linked to her cervical cancer. With the treatment and process and the cancer being at an early stage, then we have high hopes that everything will go well.